Hi, everyone. Melissa and Melissa coming to you again. And we have a really fun subject to talk about today. So, Melissa has a really, really fun dance studio, and she provides a therapeutic program for special needs kiddos. And she does amazing with it. And we're going to kind of talk through what that looks like, the type of kids that she serves, and also be talking to you parents who are caregivers for your kiddos with special needs. How can you really optimize services like this? How can you, first of all, find them? How do you optimize that? And how do you work with the instructors to be able to create the most advantageous, if you want to say it that way, the best experience for your kiddo?
I love that, Melissa. And thank you. I mean, I'm really proud of what we do. So, for anyone who's in the Massachusetts area, we're in North Attleboro, and we have been open now for 16 years, which is crazy to say. But one of the things that I was really passionate about was creating a safe space for kids who were not neurotypical. And that began as them being integrated. But I also realized that wasn't always the ideal situation for them. And so once I finished my master's degree, it's specifically in dance therapy. And then some of you who've been watching know that I also have my LMHC, that we needed to create a separate space and really tier the program to support these kids, and
Yeah,
how to help my
there we go.
conservatory kids also support, right? So how do we create this community of acceptance and love and stability, right? So, we have now some sub-separate classes for um, our children that have autism, and we also have some fully separate classes depending on, again, what makes the most sense for each kid and their individual goals. um, we will integrate if that's what the parent wants and it's safe for everybody. And again, that's an ongoing process, like whenever we are talking to some of the organizations we pair with, they'll kind of ask what that process look like. And it's really base by base, because if you've spent time with people with spectrum disorders, they're all so different, and so some can be physically aggressive, some are not at all. And obviously we just have to gauge those things. And again, it's really talking to the parents and what are the goals. And I will say, as a parent going into any program, like whether it's dance, sports, whatever, have clarity with the director, the owner, whoever's running the operation, about what is your expectations. I really have that conversation with parents, because if the expectation is they want them dancing like one of the kids in the conservatory track, then it's up to me to assess, is that possible? And sometimes it very much is. Um, we have a young lady who's been with me now for 7 years, and she's been promoted recently to our senior dance performance team. She's very high functioning. We had to work a lot on just like physical awareness, but man, like the strides she's made, are incredible. And I love watching her with my other teens, because she's hilarious, and they love her. And they also understand, though, sometimes when she says something that is maybe just a little too much, whatever, like they know to just disregard it. Like she doesn't mean any harm by it, and I think that's important for all parties involved, right? Like we could all use to do that some days outside of the world, right?
Yep.
um, but I know I was sharing with Melissa, one of the things that we really encourage parents to be able to do is to not have to be in the room. As these parents are so used to having to be hands-on in activities. And one of my hopes is that they don't have to be. I'm fortunate to have a lot of support. We have volunteers. I have interns, graduate level interns. And these are folks that want to work in this world. And so I really am like, well, here it is. I mean, they get thrown right in. But the point is I want the parents to be able to, sit, read if they want to. One of my parents comes with her Kindle and she reads, like, and she's just back there having her coffee, because she knows her child is safe. She knows that they're happy. She knows that we're going to do everything to make sure everything is good. And again, I let parents know, please don't run in at the first sign of discomfort, because all kids test boundaries, right? I mean, I can't tell you how many times a 3-year-old comes into the toddler class and they're just crying and they don't want to leave mom. Like, that's normal. So why would we do anything different of a child just because they have a diagnosis? Like, them doing that same behavior isn't strange. And there's no expectation in my establishment that they're just going to waltz in the room and do what I expect. So we're prepared to deal with a little fussing and, maybe some tears, because we want them to know they're safe and to work through that stuff with us. So that way they know, okay, these people can help me, versus mom or dad having to run in
Mm-hmm.
and fix it every time. And I would say, as a parent, I know that that's really hard, I'm sure, to listen to that, right? But the best thing you can do for your child is let them know there's these other people that support you and are going to keep you safe, right? And so, again, I can only speak to my business and my program, but ask those questions.
Mm-hmm.
Okay, what is the expectation if my child gets fussy? Am I supposed to come in? Like, will someone
Mm-hmm.
come get me? Like,
Make a plan.
again, I'm exactly, and well,
Mm-hmm.
and like, being prepared around what is this going to look like, it helps everybody. And what I also fully understand, in every parent, no matter what, your child, where they fall, wherever, when they start to have a fit, it gets a little embarrassing, right? In public, and you're like, oh gosh, I don't want to be that parent. And the thing you have to remember, though, is, like, every parent has been there at some point. At some
Mm-hmm.
point, kids push boundaries and
Mm-hmm.
sometimes they get a little loud. That's normal, right? So, what I think, there's this conditioning around, like, oh my gosh, I have to get my kid quiet or whatever. And what I love, we have a lot of parents, obviously, with kids with varying, things going on, and the moms will go, support the new mom. Like, hey, it's all good. Like, nobody cares. Like, no one, you don't have to quiet them down. And I think that is so cool to observe and to, like, hear about after. Sometimes I'm like, I went up to so and so and just let them know, like, it's okay if their kid is fussy, like, no one's upset about it. And really, when you look around, like, the waiting room, like, all the parents, again, are just doing their thing. Some of them are chatting, some of them are reading, whatever. They really don't mind that, someone's trying to get settled in. And so I'll give you guys this story because it was a powerful moment about all this. So, and I'm sure all the parents watching, your kids respond differently when it's mom or dad or auntie or whoever, right? And so, one of our little ladies was really having a hard time, and she's not out of control. Please know, we never want a child to be suffering. I am very aware of, like, are we fussing? Are we crying because we're trying to get our needs met? Or if we start screaming and we're getting really dismantled, then of course I'm going to bring them to their parent, because I know mom will probably squelch that in a minute and be able to calm them. So it's also not about letting these kids get too escalated either. So I don't want you guys to think, like, well, why are you letting them cry? But sometimes they need to work through it a little bit. So her dad brought her in, and dad's very sweet, and she was just fussy, and he said, oh, she didn't really want to get up this morning. Okay, that happens to all of us, right? And so she was just really not wanting to kind of do some of the things. And again, the expectations are different with each kid. So with her, it's just kind of getting her to the line with the kids, getting her to do some of the exercises, and then just kind of keeping her a little bit in the flow. But every now and then I let her kind of wander off and do her thing and whatever. So she was, just really upset. So I was holding her, and she wasn't getting more escalated. She was just sort of like a little teary-eyed and just kind of making these little, like, noises, but she was fine. And so, again, dad, being used to having to just rescue, kind of opened the door and said, do you need me to take her? And I said, no, actually, I would really like for us to work through this together. he was like, okay, I'm just checking. Like, I don't want her to be a bother. And I was like, she's not a bother. I think this is really important that she knows that I have her. And she's okay. So sure enough, she fussed for probably 5 or 10 minutes more after that. And then all of a sudden she was fine. Put her down. She was dancing. She wanted to like run around the room, whatever. And she walked out with a smile. And, I thanked her dad for being willing to lean into that because I get it.
Mm-hmm.
Again, you
Mm-hmm.
want, you don't want to hear your baby
Yeah.
upset, but we all know that kids want to get their needs met. And sometimes that happens with a level of manipulation, right? Every kid manipulates in some ways. And that's not because they're fresh or whatever. It's just they're trying to get their needs met. So she knows if I fuss enough, someone's going to open that door and come take me out of here. But she also realized, okay, like Miss Melissa and her crew also have me. Then she had a great time. And then this past week, she was happy as a clam. She had a great class and didn't, she was walking around smiling the whole time. And so we had to work through that. And so
Mm-hmm.
afterwards, him expressing like, thank you, like there's just not a lot of places we can do this. And that really struck me because obviously what I know is what I know and what we
Mm-hmm.
do. And I
Mm-hmm.
forget that sometimes, but I've absolutely had kids come in and the parents tell me that, another dance studio person, owner or teacher will say your kid can't come here, or
Mm.
you know, we can't accommodate or whatever. It's not often said in such a polite way, but and that breaks my heart when I'm reminded that that's happening. But one of the things you do need to advocate about, you guys, is do these people have certifications? If someone's offering a therapeutic program, and maybe they're not calling it that because that should imply some level of professionalism, but well, what qualifies this person to work with these kids?
Yeah.
What sort of courses and training have they done? Um, how aware are they really? Do they know how to de-escalate? We have a young lady that I've actually had, my goodness, she's been with me 10 years this year, and she used to be very escalated easily. I sometimes would have to kind of get between her and the floor because she would throw herself on the floor and start smashing her head. And so I had to like be under her and basically just like hold her while she like railed her head into my chest. And, that is obviously part of my training, right? Like I've learned how to, hold kids therapeutically if they need it, how to create a safe space when they're having these things. Then what do we do with the other kids when these things are happening? You need people who are aware of that,
Mm-hmm.
and ask those questions. Okay, what
Right.
happens? I mean, her parents came in and just were very clear about the fact that this is what goes
Mm.
on.
Mm-hmm.
Now, like her sister brings her, and I haven't seen mom and dad in a while because they don't need to drive her anymore. And she's great, and typically if she starts to get upset, it doesn't really ever get to that level anymore. But,
Mm-hmm.
it's been years and years of a multitude of support. So, asking about credentials and specialties is a piece. That's a huge part of it. And then also, one of the things, and I know I mentioned this to Melissa when we popped on, was, you know, are you okay with the redirection of your child? Because part of what happens, and I understand because just parenting in general is challenging, of course, and you have to be so consistent and on, and it's hard with kids who have any sort of neurological disorder because they can take anything and run with it, so that one time you don't redirect can really snowball. And so I understand that it's like you're only human and you get tapped out. So one of the things we notice a lot is just behavioral stuff, that we have a couple little guys that are very high functioning, and because they're so smart, they know exactly what they're doing. So, to someone who might not like doesn't have a trained eye, they might think like, oh, this is behavioral because of being on the spectrum, where and in fact, they're manipulating. They know 100% what they're doing. And So that really takes, again, someone who's got enough experience to be able to go, all right, this is something they can control. So we're going to work with them to control it. And so it's setting that expectation. And that doesn't mean that they don't get mad at me, like, trust me, both of our little dudes have been pretty ticked off at me at various times. But now it took about 4 months of like really hard work in there, from myself, my interns, my staff, to now where we are having really lovely classes and they're really enjoying themselves. But again, they're testing those boundaries, and now they know the expectation when I'm here is this.
Right.
And and that should also give parents hope, because if you see that happening there, it's like, oh, I could do that at home too.
Mm-hmm.
And again, I've only got to fight the fight for an hour, right? But we make sure we do that, and but make sure that also, I want you to be okay with that because it's what's best for your child, but make sure that you're okay with that, because, I understand you might not want someone telling your kid what to do, but you're also paying someone for an activity because you want them to be told what to do, right? So it's just really, again, clarity, right? Creating a plan, and setting expectations, and those will keep evolving. But I think the more questions you ask as a parent, and allowing the provider to do so as well,
Yep.
I always will ask, what formal diagnoses do we have already? What have you seen that works with redirection? What doesn't? I always want to know too. Is there something that's going to completely put them over the edge? Because we want to obviously avoid that. Is there any history of trauma? That's important for us to know, because we will be really aware of, kind of like my little rescue pup. Like if my hand goes over her head, she still is kind of like this, Obviously, I'm going to pet her, not hit her, but if your child's gone through something like that, we're going to make sure that we always come underhand if we're going to hold their hand versus coming this way, So all that information just helps everyone to provide a better level of care, but it is important to make sure that the people you're bringing them to have a clue about at least a portion of this stuff, if there's, like dance therapy programs aren't super common. So there's not like there's like a ton of us out there, but what is this even if it's a very nice human running the program, just ask those questions, because you want to make sure, that they're able to manage whatever might come their way,
Exactly. Yeah. I really love that you do this because, I work with quite a number of autistic kiddos in my practice, and they are brilliant. And some of them are so gifted artistically, but because of the nuances of how they choose to express themselves, they don't get the chances to express themselves. Does that make sense?
Yes.
So I love that you do this and provide a safe space for these kiddos to express who they are, and that it's okay that they're not like everybody else. It's not looked down on. And in fact, in some ways, it sounds like it's celebrated a bit.
Yeah.
And I really love that. To me, when I'm working with, say, an autistic kiddo, I always work through the parents, right? And this is some of the things that I hear is exactly what was articulated to you by that daddy, right? Thank you for providing a safe place for my little girl. I hear that so much, because it's like, we can't go here because they're too loud, or we can't go here because of, it's like, how do I say this? We have this expectation for behavior from kids that is, in general, that is not necessarily true. I raised 3 boys, and I'm tickled that they're boys, all boy. And I was just with them last night we had dinner together, and they were sitting around telling stories, and I'm like, oh my gosh, I'm just glad they lived to 18 and aren't missing like limbs or something.
Yeah.
But it's like, how do we create a space in which these kiddos can be all them?
Yeah.
Does that make sense? And express who they are on the inside. We all want to do that. That's innate.
Well, and I think too, like, it's interesting in our integrated classes, I have a little less freedom around that, but in our purely therapeutic ones, we have these big dance scarves, and a lot of times they love just laying under them, or we'll fan the scarves over them or whatever. And, we can allow that space in that group and just let them kind of be, and especially, I mean, even quite frankly, at the end of our neurotypical classes, I've always finished our classes with 2 minutes, just 2 minutes of freeze dance with these little ribbon wands. And I remember it was ages ago, it was when I was the director at OY. One of the moms said something like, well, like, what are they doing at the end? They're just running around. And I was like, well, first of all, it's 2 minutes. I was like, and second of all, like, that's their time to just let that out and be creative for a couple minutes, because quite frankly, those couple minutes where they're improvising and moving however they feel, if we don't foster that when they're little, when they get older and I say, okay, you've got 8 counts to move however you like, they're all like, because they've never thought about how they would like to move. So, and that's a whole other different conversation, right? About a parent who's like, well, they can't do that for 2 minutes. But, to me, that's really important, because allowing that space for any kid to kind of just let that out for a bit, and so it's interesting when we watch, especially with the spectrum kids, what they're doing in some of those moments. And a lot of them will do what we call stimming, and so that might be like, one of my little guys goes like this, sometimes they'll kind of like not fully bite on their hand, but kind of just put their teeth on their hand, or one of my little guys always grabs his elbows, and so you start to learn what that is, and you pay attention to, like, okay, and why are they doing that? And is there something I can adjust, or are they just ticked off that I'm just not letting them kind of grow, but it's like, the more we get to know them, the more we can, accommodate all that. So I think it's important for, and art is such a universal language, right? Like,
right.
My dad and I were talking about that the other day, because he's a musician. When we have kids who are nonverbal, and we have a few of them, it's like, it's funny, like, the other day, one of my little ones said the word kick, and one of them, said jump. And, this is out of a child who's not saying too many words. And so it's pretty cool that some of their dance terms, what they're remembering. And what's even cooler, sometimes I get videos from these parents, and these kids are doing all the steps we worked on. And mind you, in class, maybe they just are walking across the room with me and I'm holding their hands, but then they go home and they have retained what we worked on, because they're so smart and brilliant, and so it's just that things are getting processed in a different fashion, and that's okay, it also, I think, having patience. I'm grateful we have parents who have a lot of patience with, like, me and, my other volunteers and staff, because some kids, I'm like, are they not sitting down to do the little warm up because they just are trying to push buttons, or is asking them to sit down just going to put them over the edge? And at a certain point, I've got to make the decision, like, what are we doing? Like, and are we gonna like leave them be and they can do a warm up standing, or do they need to sit? And that might seem like such a silly little decision, but it can set up the whole class in a different dynamic, And so, it's just, and I tell my whole crew, as long as they're safe, we're good. Like, we have a ballet bar in our back studio where we usually do these classes, and I get that thing out of there as fast as we can, because of course my boys want to hang on it, right? So but that's not safe. It's not bolted to anything. So,
Right.
so we move it so that the distraction's gone. We carry on, I cover we have viewing windows. They're big. So I cover them with little curtains. Parents can still see, but just so the kids can't see their parents, because otherwise we're not getting anything done, And
Right.
so, it's good. Like, parents will kind of ask sometimes, and I'm like, well, you can still see through it, or you can go in my office and watch or whatever. But, you know, just it's not about us keeping you guys out. It's just trying to keep these
Attention's
guys.
in.
Yeah, yeah, yes, exactly.
Yeah.
Otherwise, nothing's happening, right? And so, but yeah, I think parents need to ask questions. Providers need to,
Mm-hmm.
I know there's been times where I've been like, I feel like this child's on the spectrum, but no one has officially told me so.
Right.
And it's a delicate conversation because you never want to imply, but as soon as you have updated information, giving that to the teacher or the director,
Mm-hmm.
so that way,
Yeah.
you know,
Yeah.
appropriate plans can be made, right?
Yeah. I like that. I like that a lot. And I like how um you kind of allow, how do I say this well? Parents a place of rest, but also a place that they can send their kiddo and trust that they will be cared for with the kiddo's highest interest in mind. Um, one of the things I've noticed with, especially when I'm working with autistic kiddos as a functional medicine provider, is that as we work on them and what is actually causing some of the imbalance in their body, and as they become more balanced, if that's a good way to say it, and their body starts to work better, their mind starts to work better, their cognitive um, pieces kind of start to fall into place. Um, their ability to participate in something like dance really begins to change and evolve. And I think that having something like this, like what you do alongside other therapies with these kids, can be really, how do I say this? It can really help them evolve and become like the best version of them. Because obviously, at least for most parents that I work with, their intention is for their kiddo to walk out into the world and be able to have a full and successful life, right?
Mhm.
That's a big deal.
Yeah. Yeah.
And so pairing something like this with, other types of therapies, I think is so, so valuable, because as their little bodies start to get better and their little minds start to get better, and, all the pieces that were kind of awry in the body start to kind of line up, this can give them confidence. This gives them boundaries. This gets them, problem solving. This gives them, how to express themselves in a safe and creative way that's beautiful. I really love it, and it helps to augment the improvement that we get in their little bodies as a whole. Does that make sense?
Yes. Well, it gives them community. So it's very funny. So we've got the two rooms. So on Wednesday night, front room is my advanced jazz girls that have known my little lady that I studied who's been with me for 10 years. So she's right now, she basically has a solo lesson just because we don't have any other kids her age at the moment.
Mm-hmm.
So, which is fine, her mom was so nervous. I'm like, she's fine. She does, yeah. So, but what has happened over time is she's one week decided to come out and
Mm-hmm.
tell everyone. She comes out, she goes, girls, I did my dance fabulous. And so the big girls all cheer her on and she clapped for her and she's like delighted with herself. And then off she goes. Well, that stuck, of course, because that felt great to her, right? So now every time she goes out, she does that. And the girls cheer for her every time like it's brand new, And I think it's so cool to watch, and she knows that all these people are they genuinely care,
Mm-hmm.
and
Mm-hmm.
it's also gives these girls such a nice way to like step up and support one of their peers,
Mm-hmm.
and I think it's just, we haven't had really not had any people that kind of have an issue with what we do. I had one
Mhm.
family once, this was forever ago, and they were not putting their daughter in one class because I had a young girl in there. She wasn't autistic. She had velocardiofacial syndrome, which has a bazillion different potential symptoms. But she'd been with me since she was like 7, and when I first started, I had nowhere else to put her, and so she was just dancing with the advanced girls, and she hung in there. Like, she obviously didn't dance exactly how they danced, but she was hilarious, and they all loved her little like things she'd say and whatever. And so you know, one parent was like, well, so and so doesn't want to do that class because she's in there. And I was like, well, this is the only place she can go, but your kid could go anywhere, you know? And so I ended up asking them to leave because I didn't want her feeling left out, you know? So
Mm.
I think that, again, we haven't dealt with that often, but,
Mhm.
you know, I think it's important we build our cultures around us, right? And so
Right.
it's been really important for me to make sure the culture of the studio, quite frankly, kind of mimics the culture of my other business, which is full of great people too. And
Yeah.
no, because I always say to parents, they may not all be dancers, but I still need them to be good people, you know?
Yeah.
So,
I love that. I
yeah.
love that. So, as kind of a takeaway, what would be one thing that you would tell to a parent who is thinking about taking advantage of a therapeutic dance studio opportunity, or even something similar to that? What would be your advise to them as they go through the process of finding something, really leaning into it, seeing if it is a good fit for their kiddo, and then helping to actually do that and making it a lasting commitment, something that feels really good?
Yeah.
How would you advise parents on that?
So I think making sure that, again, asking the right questions, like, all
Mm-hmm.
right, but also being transparent around
Yeah.
any safety risks or aggression that can come from
Mm-hmm.
your kid, because they need to know that because of safety for the other kids, right? Um, and it's just best to communicate. The more you can communicate, the better. You know, like, it's okay to ask my child to sit in a timeout if they're being really, you know, oppositional. Or, you know what, give them a tangible place to sit, to take space, whatever system works best. But again, communicating. Don't
Mm-hmm.
assume that this person knows how to exactly deal with your child, right? You know, make it a collaborative experience. And then also, you know, on the days when the kid, because guess what? There's going to be times where they say, I don't feel like going. Because, like,
Right.
every kid does that with pretty much every activity, right? At some point. Like, they could love it and still be like, I don't want to go, you know? And so I think it's also making sure that you honor that commitment.
Right.
Like, you know, just because this gets uncomfortable doesn't mean that we're not going to go. And that is a huge lesson for your child to learn, because in any facet, right, we need to have discipline and commitment. And so that's a really powerful way to teach them that. And again, if something's coming up, like even last week, I had a mom text me because her daughter, who's not autistic, was, you know, her brother's autistic and gets to go take a walk with the babysitter during her dance class. Well, she's jealous. She wants to go to the library, but she also wants to dance. So she's like, I don't want to go to dance class. So, you know, and I'm like, mom's texting me because she's like, something's not adding up. And I'm like, oh my gosh, she like loves being in there with her little buddy and they laugh and blah, blah, blah. And she's like, all right. She's like, okay, so I'm just going to kind of disregard like these grumblings. And I'm like, also, nowadays, kids get home, pop on devices, pulling them away from that. The best thing you can do as a parent, don't let that happen, you guys. I get it. It's it's something they can just, you know, drone into and whatever, but you're not doing yourself any favor, because when you go to try to get them off of their couch, into the car to go do something, you know, you're not going to be successful because they don't want to leave, right? So that's something that you have to remind yourself. And that's not just about kids on the spectrum, that's any kid, right? And so, you know, working with providers. So even if, say, you know, your sports coach or the dance teacher, whatever, isn't a licensed clinician, maybe doesn't have the tips, you probably have a therapist or an ABA support somewhere. Utilize them to help. You know, I know one of my little girls came in with one of her ABA specialists for a couple of weeks just to help her get used to the space. And we worked on some of the pieces. So just working and being open to it not being a cookie cutter scenario, right? Because no two people are the same. So, you know, allow the program to be modified if that's what they're willing to do. And that's where, you know, as a parent, you've got to use your discretion. Are these people willing to work with me? If they're not, then maybe they're not really prepared to work in this realm. But, you know, if you find a space and the people are kind and open and you see them really trying, like, talk, you know, don't. I think the worst thing a parent can do is just, you know, and people do this in relationships across the board sometimes, right, Melissa? Like just retreating versus having a conversation, you know, if there's something that needs to be modified, like that's okay, you know, and how can we further support, right? And so, you know, I think it's just transparency is so important in these situations, you know.
Big time. I love that. Well, thank you for sharing what you do. It's a gift. It's a gift. Where are you again? Like, if there's somebody listening and they're like, okay, I might be an hour away, but I want my kiddo to be in this dance studio. How do they do that? What's it look like? How do they get a hold of you?
Yeah, so they can, you know, email me at uniquestepsdance@gmail.com, or you can go right to uniquesteps.com. That's our website, and send a message right through there. Or you can go on our Facebook and message us, Unique Steps Dance Academy. And then from there, you know, I'll have a one-to-one conversation with the parent just to see exactly what they're looking for, what's going on. And then from there, we figure out the best spot to start them in, you know. Yeah, but we're in North Attleboro, Massachusetts. So, you know, we do have families that drive pretty far to come to us just because obviously what we do is unique. So, yeah, I mean, it's an honor to get to work with these kids and all our kids. You know, I think, again, one of the best things I see is, you know, all of our kids working together and cheering each other on. And I think that's pretty awesome.
Yeah, that's pretty cool. Well, thank you. Thank you for what you're doing. Thanks for sharing. And you guys, if you have a kiddo that you want to be in this type of a scenario, give her a call and check it out and see if it feels right for you and your kiddo. Because something like this feels simple, but it can be so foundational.
Yeah. Yep.
Awesome. All right, you guys, enjoy your day, and we'll talk to you next week. Take care.